to be inclined in committing crimes. Are humans just violent species?
We are students from HRD 102 and we're here to discuss how substances and alcohol are commonly associated with murder, abuse, and homicide cases.
In reference with the study entitled Psychoactive Substance and Violent Offences, a retrospective analysis of presentation to an urban emergency department in Switzerland. Our group will be explaining what type of psychoactive substance are commonly involved in interpersonal violence.
Psychoactive Substances and Violent Offences, a retrospective analysis of presentations to an urban emergency department in Switzerland. Psychoactive substances are often regarded as possible contributing factor on cases like violent injuries, sexual abuse, and homicides. Some examples of psychoactive substances include alcohol, caffeine, nicotine, marijuana, and certain pain medicines. It is said to be that alcohol and drugs are present in both offenders and victims in many violent cases, and the prevalence of violence is higher among people who abuse these types of substances. For example, the alcohol. It is one of the most commonly used psychoactive substance in Switzerland. It subjects relaxation and positive mood when used moderately, but it is also associated with aggressive behavior and violent crimes when abused. Data from Switzerland on the acute toxicity of psychoactive substances show that cocaine and cannabis are the psychoactive substances most commonly associated with presentations to the emergency department. Based on the data from both hospitalized and emergency department patients, cocaine is related on aggression and marijuana is found to be associated with greater likelihood to commit violent offenses than no or rare use. But other researches seem to conclude that there are differences between expected association and clinical experiences of some psychoactive substances. For example, the benzodiazepine. It's expected to resemble the effects of alcohol since they have similar properties. However, benzodiazepines are often regarded as an anti-aggression drugs. Possible explanation for this discrepancy may include individual differences such as age, personal history on mental disorder, and or dose-related effects. There are currently only limited data related on ED presentations associated with psychoactive substances other than alcohol. That is why this study was made.
At the moment, there are no data available on self-reported and analytically confirmed substance use in patients with violent behavior and assaults presenting in urban EDs in Switzerland. Since this is a frequent problem, the present study aimed to describe the presentations related to violent assaults in association with psychoactive substance use at a large urban ED in Bern, Switzerland. Over a period of 4 years and 2 months, our main objective was to collect data on the type and frequency of psychoactive substance used in cases of ED presentation related to interpersonal violence.
So, for the methods that researchers use is retrospective study. Retrospective study at the University Hospital of Bern, Switzerland between May 2012 and June 2016. This retrospective study was approved by the local ethics committee. So, what is retrospective study? The retrospective study is a study that analyzes two groups of individuals, those with the disease or conditions being studied and a group of individuals who do not have the disease or conditions but are extremely comparable to the cases. The investigations focus on cases of violent crime involving psychoactive substances, cases of isolated ethanol intoxication, suicide attempts, and the last one is medical substances. Use were all excluded. The Insulspital Bern University Hospital's emergency department serves a catchment area of approximately 2 million people in the canton of Bern, with approximately 40,000 emergency admissions per year, greater than 16 years of age, and serves as both a primary care facility and a tertiary referral center for other hospitals in the area.
Upon the study concluded from May 2012 to June 2016, there were 164,846 ED presentations. 1,945 cases of those were associated with violent offenses, 1,697 patients as victims, and 248 patients as offenders. 386 cases among these was said to have alcohol, and 106 were a combination of psychoactive substances and alcohol. 34% of the patients were brought to the ED by ambulance and 17% under police escort. 16% of the cases under the ED was associated with inflicted injury, and 91% patients both suffered and inflict injury in some cases. Among the 61 cases of patients who reported using drugs, 6 and one of them reported that they have used 3 or 5 drugs, and 56 of them reported that they have used 2 drugs. In 88 cases, the patients brought up informations by self-report, and 6 cases where the patients provide informations of the substance use by itself, and others, while 13% cases was derived from urine drug screening tests. 34% of the cases from urine drug screening tests were renounced identical with the patient's report. In 6 out of 35 cases. Alcohol co-use was confirmed analytically in 22% cases. It was derived that psychoactive substances used dominantly was cannabis, range 46%. Cocaine was next with 19%. Patients who used this committed 52% bodily force violent crimes, and 30% from blunt and sharp objects, and 18% from other types of violent crimes.
Hello, this is Ericka from HRD 102 presenting our group's conclusion. In our conclusion, besides alcohol, cannabis and cocaine were the substances most often reported in ED presentations related to violent offenses in our study. However, alcohol co-use was reported in the majority of the cases, and alcohol cannabis was the most commonly reported substance combination. Therefore, it is not clear to what extent each of the psychoactive substances alone could have contributed to the expression of interpersonal violence. Future multi-center studies with a prospective study design and focus on mono-intoxications would help to eliminate bias such as individual characteristics and to understand and evaluate the contribution of each psychoactive substance separately. However, combinations are more common and this is therefore very difficult to accomplish in a real-life ED setting. Cannabis and cocaine were, besides alcohol, the substances most often reported in ED presentations related to offenses of violence. Because of the high prevalence of alcohol co-use, no final conclusion can be drawn on the contribution of single substances.
The present study described the type and frequency of psychoactive substance used in cases of ED presentations related to interpersonal violence. Besides alcohol, the substance most often involved were cannabis and cocaine, while other psychoactive substances were comparatively infrequently reported or detected. In most cases, the patient was male, between 21 and 30 years old, and was brought to the ED during the night in a weekend after an urban violence offense. In more than one-third of the cases, the personal history of the patient included chronic substance abuse and approximately one-fifth of the patient suffered from psychiatric disorder. In our findings, cannabis seems to play a dominant role after alcohol for presentations related to violent offenses. However, this estimation should be interpreted with cautions, as cannabis is the most commonly used drug in Europe and the prevalence of use must also be considered. Furthermore, as cannabis was also the most commonly detected substance in our study, it must be stressed that the urine test can remain positive for days or weeks after cannabis use. Thus, a positive result does not necessarily indicate cannabis use in the hours prior to the presentations. An interesting finding in our study was the absence of reported or detected novel psychoactive substance despite previous findings suggesting an increased risk of violence associated with the abuse of such substance. Therefore, possible that those substances were not found in our study because of possible reasons could be that the toxicological properties of novel substance are not associated.
The crimes recorded on this study, which are affected by the psychodynamic substances, were huge and it spreads all over the world, especially in urban cities where innocent people gets involved because of patients being laced by these so-called addictive substances. There are some kinds of drugs or other substances that affects how our brain works. It also causes changes in our mood, awareness, thoughts, feelings, or behavior. Still, one of the best remedy recommended by various professionals was to use the substances with proper moderation and not with exaggeration.